Hello and welcome to The Point. I'm Marcel Wieder, coming to you from our studio in downtown Toronto. Today on The Point, the debate over immunization continues as more cases of measles have been confirmed in Ontario. The provincial legislature is back in session. We take a look at what's in store with Aurora's Craig Hughson. All that and more on this edition of The Point. Measles is considered one of the most contagious diseases. Even though a vaccine is widely available, health officials have confirmed at least 16 cases of measles in the province so far this year, including 9 in the city of Toronto. One mother spoke out on social media against anti-vaccine activists after learning her 15-day-old son had been exposed to the virus. The post went viral and has been shared nearly 300,000 times. We have Shalini Desai from Public Health Ontario to discuss this issue. Thanks for joining me today.
Marcel, such a pleasure to be here. Thank you for having me.
So as a pediatrician, you've seen the measles firsthand and other types of disease. How would you describe what measles looks like to the naked eye to a layperson?
So measles is an infection, a viral infection that causes similar symptoms to like fever, cough. It can make your eyes become red. It can give you a fever. And what's most characteristic about it is the rash. So it's a rash that starts on your face and moves down your body. It can lead to a number of different complications such as pneumonia, diarrhea, and in very rare cases, swelling of the brain called encephalitis, and in even rarer instances, death.
There's been a lot of concern about what's happening with measles. The Deputy Public Health Officer in Toronto sent a letter home to hundreds of thousands of students in the public school system, warning about kids who have not received their vaccinations, that they won't be allowed back if their school has an identified case of measles. There's been a lot of talk in the media on the issue, and especially on social media. So we need the facts, and so we're turning to the experts. Can you help us understand and walk us through some of the concerns that are out there?
So good questions. I do think that the measles, mumps, rubella immunization is a safe and effective vaccine. It provides protection against measles as well as mumps as well as rubella. For measles, if you've received 1 dose of vaccine, your level of protection is 85 to 95%. If you've received 2 doses of vaccine, it's almost close to 100%.
And we've seen on social media people saying, well, we haven't had measles in decades. Why do we need to bother? It's pretty well eradicated.
So I've heard that as well. And I think what we have to understand is that within Canada, we don't see very much measles at all. But as soon as you travel somewhere, anywhere really, outside of the Americas, measles is endemic. So France, is reporting, Europe is reporting thousands of cases every year. Other places like the Philippines, after they had their natural disaster and everything, there was a huge increase in the number of cases from there. And so what happens is for individuals that are Canadian and go and travel to any of these places, they're susceptible. And they can bring that back with them. Alternatively, if we have visitors where it is endemic, they're potentially going to bring it here as well. So in the context of international travel and what we do as a country, lots of people travel, not being immunized, you're leaving yourself open to the possibility of getting measles.
Now, I received an email from a public relations firm in the US that is comparing measles to Ebola. They're saying that measles is the North American version of Ebola, which I kind of find a little hard to take, but the fact is that they're saying it's, it's a huge risk and it's contagious, and there seems to be a lot of scaremongering going out around this whole issue.
So I think, first of all, measles is not Ebola. They are both viral infections. Measles is vaccine preventable. Ebola is not. We have not had any cases of Ebola in Canada, but we have had cases of measles in Canada. I think some of the fear-mongering and the scaremongering, as you call it, is perhaps an attempt at getting people immunized and making sure that people check those immunization records and get themselves immunized so that we don't continue to see ongoing spread of measles.
And I also understand that Ontario provides for newborns up until teens a series of different vaccinations to cover a number of different childhood illnesses, something like 22 if I understand.
I haven't gone to count them all, but you're absolutely right. There's like our routine immunization program covers a whole bunch of different bacterial as well as viral illnesses that are common for individuals in the world.
And in Toronto, have we seen any identified cases of measles at this point?
So we have. So our most recent Ontario-wide numbers are we've seen 16 confirmed cases of measles in the province of Ontario. In Toronto, we've seen 9 cases.
9 cases. And are they all family related, or are they geographically dispersed?
So some of them, now we're actually seeing some cases within the province. We're seeing some cases where one case was a family member to a second, but we haven't been able to find a common source. So if we think back to, for example, the outbreak in Quebec in 2011, they were able to link their cases to specific importations from Europe.
Right.
We haven't been able to do that with our cases as yet. We're still looking, we're still trying to put the pieces together to figure out where this would have come from, but we don't know that as yet.
So what steps should we be taking other than the obvious of getting vaccinated?
So I think that is the most important message is number one, number one, check your immunization status and that of your children. If you're unsure what it is, go visit your healthcare provider and hopefully they will have that information. If they don't, there's no harm in getting an additional dose of measles, mumps, rubella vaccine. The second thing is if you suspect that you may have measles, what would be really helpful in terms of our public health response is call your physician ahead of time before you go see them and tell them that you think you may have measles.
And as a public health policy, how do we encourage more people, especially new Canadians who may not have a tradition of immunization in their former home countries, to encourage them to get vaccinated?
So that's a really interesting question, Marcel, because I actually think that many of our families that come from not Canada, that have immigrated here, actually have experience with some of these vaccine preventable diseases. So I actually think that they oftentimes are eager to get their children vaccinated because they've seen cases of measles. They've seen the complications due to measles.
Now, the study that you referred to was published in the Lancet in England several years ago, and is now being widely discredited. And in fact, the Lancet itself has very critically condemned the article and withdrew their endorsement of it. And so, a lot of the people who are anti-vaccination have cited this over the years and used it as a reason, not to get vaccinated.
So you're right, they have. And I think what's happened is that when that study first came out, there was a lot of publicity around it. And when the Lancet went ahead and said that actually, we don't believe what is in this publication, that wasn't as widely publicized. And so individuals that heard about the original study may not have heard about Lancet withdrawing their support for that study. So again, what I would say is I would encourage people to have that conversation with their family doctor, their pediatrician, or whoever it is that provides their health care.
Now, we've seen mostly in the US, I'm not so sure about Canada, a number of public figures have said that they will not vaccinate their kids, including Hollywood celebrities and some public politicians in the U.S. That type of, in my opinion, irresponsible messaging doesn't help in terms of combating these types of diseases, these preventable diseases.
So I agree with you, and I think that what I would encourage people to do is to go speak to their physicians, go speak to their healthcare providers. They've spent a lot of time studying and learning about these diseases as well as the vaccines that prevent them. I think having that conversation oftentimes is helpful.
And is there anything that the Ontario government is doing to get the word out to the public?
So they are. The Ministry of Health and Long-Term Care as well as Public Health Ontario are working together in the form of different advisories as well as public question and answers to try and answer some of these questions. I think local public health is doing a really good job of having additional clinics available so that measles, mumps, rubella vaccine can be offered to anybody that is unsure, is not fully up to date on their immunization.
Now, I know there was a clinic available in the West End a few weeks ago. I don't know if they're still offering that, but you could go to any public health Toronto and receive an immunization if you don't have your own family doctor or pediatrician.
Yeah, so what I would encourage people to do is call their local public health unit so that they know where those clinics are occurring and when they're occurring. They should be able to get the vaccine free of charge.
Well, thank you so much for providing us with updated information and helping to explain some of the issues surrounding the vaccination.
Well, thanks for having me, Marcel. I really appreciate the opportunity.
Thank you, and we'll be right back. The 41st Legislature is back in session after adjourning on December 11th. The Premier has a bit of a bounce in her step after winning back the riding of Sudbury from the NDP. However, she and her senior aides are facing some tough questions as the OPP is investigating the Liberals over allegations of corruption in the Sudbury by-election. The probe is threatening one of the Premier's highest-ranking advisors. For more, Aurora's Craig Hughson joins me. He is a former Liberal candidate, as well as a former Chief of Staff to several ministers. Thanks for joining us, Craig.
Good to be here. Thanks, Marcel.
So, Craig, the legislature is resumed. The Premier has a new member on the Liberal benches. Glenn Thibeault won a by-election. It's somewhat being overshadowed by controversies in Sudbury involving the Premier's Deputy Chief of Staff, Pat Sobera, as well as local Sudbury fixer, Jerry Lougheed. What do you make of what's happening with that in Sudbury?
Well, I think in Sudbury, the information was all out there before Election Day, by-election day, and the Liberal candidate, former New Democrat MP Glenn Thibeault, still won the by-election, and by a healthy margin, 1,500 votes or so. So I think Sudburyans saw it, but didn't care and wanted a member in government to represent Sudbury for the next 3.5 years. So in Sudbury, the story is over. The hyper partisans, I think, have certainly weighed in, and the New Democrats and Conservatives are mad as hell, and the Liberals were, okay, well, this is what happens, and all party leaders name candidates, all party leaders talk to their past candidates and tell them they'd like to be part of their team, and this is just a regular order of business.
Now, what was interesting is that we had the NDP, both federally and provincially, working together to defeat Thibeault, who is the former national caucus chair of the NDP. So in a provincial by-election, Thomas Mulcair actually went in to stomp on behalf of the local NDP candidate. And Andrea Horwath made numerous visits there as well. How is that being reflected in the NDP now that Thibeault is sitting in the legislature?
Well, he certainly got a tepid welcome when he took his seat in the Ontario legislature on the first day back, and Andrea Horwath gave him a less than hearty handshake when he was walked into the legislature. But the rank and file and the partisans in the NDP party are certainly still stinging from this. It wasn't anything they saw coming up to his departure and switching sides. So the NDP are reeling internally, and their members are really, really upset.
Ontario PCs, their candidate Peroni came not in third but actually in fourth behind the former Liberal candidate Olivier, and they did not do very well.
No, partly I think Conservatives have never done well in Sudbury in recent years, so hard to get a whole lot of excitement in this campaign for a Conservative, especially when you look at the PC party right now, led by interim leader Jim Wilson, who didn't spend a whole lot of time in Sudbury. The leadership candidates of the party went to Sudbury to visit, but not able to drum up a whole lot of interest in Paula Peroni's candidacy in Sudbury.
Now, you raised something since our last show. The final deadline to be a candidate for the Ontario PC leadership came and went. And while there was anticipated there would be 5 candidates, in fact, at the end of the day, there are now only 3.
Well, the longtime Conservative Ontario membership, the Ontario Conservative PC membership, is scared and frightened that Patrick Brown is going to run a very strong leadership campaign. He is selling new memberships. He is working very hard. He is tagging along with Jason Kenney and signing up a lot of non-traditional PC supporters to join his leadership team. And the rank and file members have decided that, okay, if we want to pick someone from the family, it is going to be Christine Elliott, and they've rallied behind her.
Now, during the last couple of weeks, we saw that in Toronto, Rob Ford is supporting Monty McNaughton, and brother Doug is supporting Christine Elliott. So the Ford brothers have split, and so are they able to deliver any of the so-called Ford Nation for their respective candidates?
I really don't think that they're going to sway a lot of voters one way or the other.
Now, we've talked about the NDP and the PC situations. Let's get back to the Liberals. So Kathleen Wynne's session is being overshadowed by 3 OPP investigations. She's inherited the Orange investigation, she inherited the gas plant investigation, and now she has one of her own with the Sudbury by-election. How is that taking the focus off of governing and dealing with these types of situations?
I think it'll be a lot of theatrics at Queen's Park and in question period, but really the government is not fazed by any of these scandals or investigations. The Orange one has been going on now for how many years, and no end in sight, and not a whole lot new to report on that front. So certainly not distracting Kathleen Wynne and her cabinet ministers from moving forward on their agenda. The gas plant scandal has popped its head up once in a while, and I think the most recent piece on that was the OPP trying to get the former Chief of Staff to McGuinty's
David Livingston
BlackBerry and his mobile device so that they could check the BBM messages or something less than Ontario government emails that they now have. So there's that, but really Kathleen Wynne and her team pretty much coated in Teflon on those 2 files and managing them as best as need be, but until the OPP come up with real charges or move forward on those investigations, really not a distraction. The Sudbury by-election, it was a little different in that Kathleen Wynne owns it. Pat Cervera, her chief of staff, her deputy chief of staff, is very close to Kathleen, came to the team with Kathleen, and Kathleen Wynne did announce on the first day back in the legislature that she was not going to punt her deputy chief of staff during this ongoing investigation. She's sticking by her, which she has to do due to just the closeness of the two. And but I don't think there's anything new that's going to come out of this aside from whatever the OPP decides. So we as the public, anyone that wants to hear that tape has heard it, the taped conversations between Sorbera and the candidate, the past candidate. So it's all out there. There is no ticking time bomb. There's no new piece of evidence that's going to materialize here. The opposition is going to be hard pressed to make this issue have legs for any serious length of time.
Liberal MPP Mike Cole came out with a comment regarding the floor crossing of federal conservative Eve Adams to the Liberals. And she was about a couple weeks ago, and she indicated that she wants to run against Joe Oliver in the riding of Eglinton Lawrence, which is Mike Cole's provincial seat. And Cole, in a response, I think on Facebook or somewhere, said over his dead body. And that apparently has made news right across the country. And it certainly weighed in terms of how the federal-provincial dynamics are playing out. What do you make of his comment, and will it have any impact?
Well, I think it's an incredibly irresponsible comment for any elected official in any capacity to make. So I was really disillusioned with the comment and disappointed that an MPP would make that comment. Mike Cole has been an Ontario cabinet minister under Dalton McGuinty, and certainly is making statements like this, will never be in cabinet again. So, but to see the infighting, I don't know that Mike Cole will. He'll certainly work hard to nominate a candidate other than Eve Adams in his federal riding. But it'll be interesting to see the local dynamics play out. I couldn't guess who's going to win that one. I know Eve Adams has brought on some heavy hitters on to her campaign for the nomination. Former Kathleen Wynne, campaign manager, in fact. Tom Allison, former John Tory mayoralty campaign manager.
Who was our guest on our last show.
Right. So no stranger to winning a tough campaign is Tom Allison. So the riding will be a hotbed of activity and should be fun to watch. But I don't know that Mike Cole will sway a whole lot of voters one way or the other on that one.
Well, we'll definitely watch that. And we've got a lot more provincial activity taking place over the next few weeks with a budget coming down the end of March, I would assume.
Yes, that's
and a number of other things that are going to affect the city and the province. So we'll have you back to give us updates on what's happening at the legislature. Thank you so much for joining us, Craig.
Oh, thanks, Marcel. Good to be here.
It's a point of pride for most Canadians, whether on a backpack, on a soldier's uniform, waving it during a gold medal game, or seeing it on the side of the International Space Station hundreds of miles up in space. It's our flag. On February 15th, we celebrated a small milestone, 50 years since the flag flew proudly for the first time in Ottawa. As someone who has traveled the world, I find that when people see my Canadian flag, it is usually accompanied by a smile and a nod. People recognize our flag for what it stands for, a country that embraces community, diversity, opportunity, respect, and tolerance. The new flag signaled Canada was coming into its own as a nation. It showed the world we were ready to take to the international stage. 2 years later, the new flag flew proudly to mark Canada's centennial year and welcomed the world to Montreal for Expo. Since then, it has become a universal symbol to the world as one of the best places to live. Unlike our neighbors to the south, we Canadians have a different relationship with our flag. It's not celebrated in our national anthem, nor is it hung on every pole, house, and building. Instead, Canadians display a quiet confidence and pride in what our flag represents. And despite our occasional differences, Canadians from coast to coast to coast are happy to find an opportunity to unfurl the red maple leaf on a white background bounded by 2 red bars on either side. So happy birthday, Canadian flag, and thank you, Prime Minister Lester B. Pearson, for showing the leadership necessary to see our new flag born. May our flag continue to proudly fly for many years to come. And that's the point. That's all for this edition of The Point. Follow us on Twitter at Watch The Point, like us on Facebook, and download our episodes from watchthepoint.libsyn.com. Thanks for joining us today.